Shalom and welcome. I'm Angelica Berry, president of the Russell Berry Foundation and a longtime supporter of the Technion, where we established the Russell Berry Nanotechnology Institute. It's an honor and a pleasure for me to participate in today's session and introduce a personal friend and partner, Professor Peretz Lavie. The subject of sleep has been a national health issue even before stress from the coronavirus disrupted the sleep cycle of people all over the world. In America, 70% of adults report that they obtain insufficient sleep at least one night a month, and 11% report insufficient sleep every night. It's estimated that sleep-related problems affect 50 to 70 million Americans of all ages and socioeconomic classes. The impact on American life and economy is enormous, as sleep deprivation and unrelated sleep disorders are estimated to cost over $100 billion annually in lost productivity, medical expenses, sick leave, property, and environmental damage. In this time of pandemic, a recent survey showed that 3/4 of Americans are having trouble sleeping. Today's subject couldn't be timelier. We'll explore how sleep affects so many of us today with two world-renowned sleep experts. Professor Peretz Lavie is someone we all know and respect. In his 4 decades at the Technion, Peretz was the dean of the medical school and the president of the Technion, the first president to serve for an historic 10-year term from 2009 to 2019. And just adjusting my volume here. He established the Technion Sleep Medicine Center in 1980, the first of its kind in Israel. As president, he oversaw the establishment of the Joan and Irwin Jacobs Technion Cornell Institute in New York City and the Guangdong Technion Israel Institute of Technology in China, two monumental accomplishments that elevated the Technion on the global stage. He's also authored several influential books on sleep and sleep disorders and is one of the leading founders in the field of sleep medicine. And since retiring from the Technion, he has served as a consultant to universities in South Korea, France, and Portugal. Joining Professor Lavie to discuss sleep and dreams during the coronavirus pandemic is Dr. Qanta Ahmed. Dr. Ahmed is an associate professor of medicine at NYU Langone, Long Island School of Medicine, and is a pulmonologist and critical care medicine and sleep disorder specialist. She's based at New York University Winthrop Hospital in Mineola, New York, and she was at the epicenter and is still at the epicenter of the coronavirus pandemic. Dr. Ahmed's academic work includes mass gathering medicine and public health. She's also a broadcast commentator and columnist for a number of media outlets and a very distinguished recipient of an honorary fellowship from the Technion bestowed by President Lavie in 2015. You will be able to ask questions of our guests by using the Q&A feature at the bottom of the webinar window, and we'll address them at the end of both presentations. Peretz and Kanta, we're thrilled to have you with us today. And after your presentations, Jerry Kleiman will join us to facilitate questions. And for those who are not able to join us, this webinar will be recorded and accessible in a few days. It's my pleasure to turn the conversation over to Professor Peretz Lavie.
Angelica, it is wonderful to see you, and thank you for your kind words. I do hope to see you again shortly, either in Israel or in the US. And on behalf of the Technion, I would like to thank you and your fellow directors at the Russell Berry Foundation for their extraordinary support. From the iconic Calatrava obelisk to the transformative gift to establish the Russell Berry Nanotechnology Institute, you have changed the Technion forever. Your recent support of young faculty and graduate students in memory of our beloved Norman Seiden will help advance careers of young scholars for generations to come. Thank you, Angelica, and a hug from far away. Well, sleep. I think that we have something that can be termed as a perfect storm regarding sleep. The number of people who complain about sleep is enormous. People complain about difficulties falling asleep, frequent awakenings from sleep, nightmares, dreams with intense content, and the numbers are staggering. And there is no wonder. Sleep is one of the most sensitive barometers of our mental life. We respond to stress with sleep. Sleep is affected by stress, and I don't think that anybody will argue that recent months showed us that stress can be a universal phenomenon. The pandemic, the corona pandemic, affecting the entire globe, and people respond to stress with sleep disorders. And in addition to the fact that we have anxiety about the pandemic, with anxiety regarding our own safety and our own health and the health of people close to us, the pandemic have changed our life. Routines are changed. Suddenly, we have to keep a social distance. We are not going to walk as we used to. We are not going to the exercise room as we used to. Suddenly, we are confined to our apartments. In Israel, for instance, for about a month, we couldn't leave the house, and we have to find a way how to live within the house and establish a new routine. So the sleep routine has changed not only because of stress, but because the change in our lifestyle. Now, stress is affecting our body in many ways. Stress is releasing hormones, mostly cortisol and adrenaline, which keep us awake and interfere with our sleep. Stress is a phenomenon that is very difficult to cope with, particularly when the period is such prolonged as we are witnessing in recent months. Moreover, our sleep-wake cycle is regulated also by the environment. The light-dark cycle dictates our sleep behavior. We are going to sleep during the dark period. We are awake during the light period. And suddenly, we are not exposed to the sun because we are confined to our houses. And the only light is artificial light that in many cases is not sufficient in order to drive the sleep clock, the sleep-wake clock. So there are many reasons why we suddenly have disrupted sleep to such a magnitude, and so many people complain about it. What about dreaming? Again, dreaming consists about 20% of our sleep, 20 to 25% of our sleep, dreaming sleep. This is a period of sleep that has a very, very unique characteristics, physiological characteristics. Certain brain waves, the eyes are moving, the muscles are paralyzed, and our brain is active. The brain gets more blood during dreaming sleep than during any other sleep stage. And dreaming is also occurring in a cyclical way during sleep. We start the first dreaming period, or as we call it, the REM period, rapid eye movement period. Rapid eye movement because it is characterized by rapid eye movements while we are asleep. The first one occurs after 90 minutes, then 90 minutes later, and then 90 minutes later. And the length of the dreaming period is increasing throughout the night. The first one may be 5 to 10 minutes, then 10 to 15 minutes, then 15 to 20 minutes. And throughout the morning, we may have dreaming periods of at least half an hour. Now, people now report on more intense dreaming, more bizarre dreaming, more emotional dreaming. And there are two reasons for that, in my opinion. First, many of us delay our waking time. Instead of waking up at, let's say, 6 o'clock in the morning, when dreaming period is usually about 15 to 20 minutes, suddenly we wake up at 7 to 8 o'clock in the morning, when dreaming period may last for almost 40 minutes. So the reason is we have a higher, more dreaming period in the last hour of sleep, so the chances of waking up during a dreaming period are much higher. And the ability to remember dream is first and foremost dependent on the stage of sleep from which we wake up. If we wake up from a REM period, from a dreaming sleep period, the chances are about 80% that we remember a dream. If we wake up during one of the stages outside the dreaming period, the probability or the chances of remembering a dream go down to less than 20%. So why the intense dreaming? Why the nightmares? Why the emotional dreaming? Usually we dream about things that are important for us during the waking period. Many years ago, I conducted a study about dreams of Technion students. We asked them to come to the laboratory. They slept in the laboratory for a few nights, and each time we saw that they entered the dreaming sleep based on the eye movements and the brain waves, we woke them up and recorded their dreams. And then we analyzed the content of the dreams, and we have about 400 dreams of these students. The number one subject of the students in the Technion during that period, this was the late 80s, was serving duty in the army and who is going to cover me in the classes and copy the lectures for me. This was the number one that appeared in the dream. During that period, this was an intense period with respect to the events in Lebanon. Many of our students spent time in reserve duty in Lebanon. So this entered the dream and occupy the dreaming brain. This was the number one issue. The number two issue was results of a test, teachers, etc. Only number three was dealing with what we would consider interrelationship with the other sex. Men dreamt about women and women dreamt about men. So it is no wonder that when we are flooded with information about the events all over the world with the pandemic, that this penetrate our dreaming brain. And the brain tries to analyze this information, and part of the analysis is done during dream in a way that we do not fully understand so far. But there is no doubt that we dream about the events that are most important to us. And now the events that are most important to us are the pandemic and the anxiety related to pandemic, and this affect dreaming. So many of you will ask me, okay, so what would you suggest how we keep our sleep intact, how we improve our sleep? I think that the number one rule in order to keep sleep as normal as possible is to keep a routine during the day. To keep a routine, to go to sleep at the same time, to wake at the same time, to fill the day with exercise, with light exposure, to continue our routine daily life as normal as possible. This, there is no doubt about it, will also regulate sleep. Because if you go to sleep one night at 10 p.m. and one night at 12 p.m. and one night you decide, oh, tomorrow anyway, I'll wake up at 10 in the morning, I'll go to sleep at 3 a.m., this is a recipe for a disrupted sleep. So keeping a routine, going to sleep at the same time every night and doing during the day events, keeping the daily routine centered around events like exercise, exposure to light, etc., not eating too late at night or not drinking alcohol at night, this will protect our sleep. And what happens if you find yourself in bed and cannot fall asleep? Don't try to fight it. Don't try to force yourself to go to sleep, because this can be develop a habit. This can develop what we call a conditioning of insomnia, of inability to sleep. Leave the bed, go to another room, try to relax, and then once you feel that you're ready to go to sleep, go back to your bed in order to try and reinstitute sleep. Couple of words about alcohol. Many ask me, and this is something which is very common, well, what about a drink before sleep? Alcohol is a very tricky solution for sleep disorders, because indeed when you drink alcohol, sometimes you feel sleepy and it helps you to fall asleep. But after a couple of hours, it kicks you awake. Once alcohol is metabolized, the metabolites of alcohol keeping you awake. So maybe you fall asleep faster and easier, but after a couple of hours, you find yourself wide awake without the ability to go back to sleep. So alcohol is not a solution. What about sleep medications or sleeping pills? Here again, in the long run, this is not the best solution, because most of the sleeping pill, there is a tendency to dependency. Many of the sleeping pills after prolonged use lose the ability to affect sleep. For a short-term period, there is some benefit for sleeping pills, but you have to be very careful not to get to the habit of using sleeping pill for a longer period of time. And I'm sure that Dr. Qanta Ahmed will talk about it as well. So sleep has become an issue. Just to give you an idea, and Angelica Berry mentioned it, when you try to find out how many items on the universe of Google, there is the combination of coronavirus and sleep, there are 30 million items related to coronavirus and sleep when you combine them together. So sleep is a universal problem that affects our life, and the consequences of disrupted sleep, the long-term consequences are such that it affects our health. Recent studies show that disrupted sleep or insufficient sleep affect the cardiovascular system, affect obesity, promote obesity, and most importantly, during the pandemic, affect our immune system. Insufficient sleep and disrupted sleep deteriorate our ability to cope with infections. And when you deal with a virus like coronavirus, you need to sleep and to sleep well in order to deal with this pandemic. I'd like now to call upon my colleague and very, very close friends, Dr. Kanta Ahmed. You heard before from Angelica Berry that Kanta is a sleep specialist and pulmonologist, but now she combined in the last few months, not only her expertise on sleep, she was in the eye of the storm. She will share with you some of the experiences she had as a specialist in the ICU that saw so many coronavirus patients. And Kanta, the floor is yours. Lovely to see you, lovely to hear you.
Thank you, Peretz. It's lovely to see you and all of our colleagues at the Technion. This is a very important meeting. I'm glad to participate. I have to say, as I'm listening to you, I was thinking about how things started. And as you know, the first person with coronavirus that was found in New York was the 7th of March. At the beginning of March, I had tickets for a play on Broadway around the 26th of March and fully expected to go to that. And of course, things moved so quickly, but by about the 20th of March, I had volunteered, left my sleep practice, and joined my colleagues in the ICU. To give you an idea, our hospital has 711 beds. At our peak, we housed over 800 patients with COVID. We expanded our hospital 25% in capacity. We normally have 3 adult intensive care units. We had 15 at its peak. We had 152 people on mechanical ventilators at the height of the pandemic, which was towards the later part of April, more than the state of Israel had in its entirety. And we spoke at that time, if you remember. So the sleep changes I was beginning to see happened in the first 1 or 2 weeks while I was still seeing patients in my office. They had been asked to stay home. Nobody was working. People could still come to see the doctor at that point. And all of my patients were phase delaying. That means they were staying up much later and sleeping much later. After the pandemic, I just came back to my office 2 weeks ago, and I'm documenting now patients that are normally on CPAP. They have an extra 90 minutes of total sleep time compared to this time last year because they're still not going to work. We live in a very expensive area, the tri-state area. 23 million people make their home here in New York, New Jersey, Connecticut. It's also where the pandemic hit hardest. So people have very long commutes normally from home to work. That's gone away. If people have work, they're going downstairs or in the next room to work, so they have more total sleep time, or they're not working at all. I have begun interviewing patients about their dreams since you and I spoke, Peretz, because there have been reports in the general media about people's more vivid dreams, more intensely remembered dreams, not always nightmares. As a clinician at the front line in the critical care unit, I had all the sleep disorders I expected. Early morning awakening began first week, not being able to sleep through the night and waking up at 4 a.m. just with the anxiety of going into the ICU or going back to the ICU or dealing with the aftermath of the ICU. And that affected many of our colleagues. Many times as a professional looking after critically ill patients, I had dreams that I was delivering critical care amongst my dead patients. And that is not an unusual dream for anybody that practices critical care. But in the general population, when I ask my patients, some of them are reporting more vivid dream content. And there is a fabulous website a layperson has put together, and I want everybody to go and explore it later. It's called I Dream of COVID. And it's an invitation for anybody to describe their dream, their age, and which country they're from. And it's remarkable. There are a lot of reports from New York where people are dreaming about mass inoculation, mass exposure. People are dreaming about officials coming to the door and asking for papers. A lot of the themes of this pandemic are showing up in people's dreams. I agree with everything that you're saying in terms of the recommendations for what we call sleep hygiene, a fixed routine, daylight exposure. One of the enormous changes, even though we were already a nation that consumes high amounts of screen time, television, iPads, laptops, cell phones, people are watching even more of this content. And then even the entertainment they're watching are movies like Contagion or shows like The Pandemic or Bill Gates' lectures on a forthcoming pandemic. So the consumption of information has been overwhelming and the output has been overwhelming. And I recommend to my patients cutting off the digital devices. I've had to do that myself and actually start watching very light entertainment or just going for a walk in nature now that we're able to move around a little bit in New York City. I think we should also say, to give you a sense of the scale, at my hospital, we admitted close to 2,000 people with COVID in total. We know in New York, there were 208,000 cases. In the whole United States, 1.9 million. In the whole world, 6.7 million and counting. So even though we are in the epicenter of the pandemic, the impact of this disorder at the moment is only measured in hospitalizations. Remember at the peak, I said we had 152 people on ventilators. We had a total of 465 acutely ill people, either in the ICU or on the wards, but not able to get into the ICU. And we were still delivering critical care in those places. But the actual impact on society is going to take decades for us to really understand, because so many people in this area have lost someone. Even I was just listening to a neighbor play a trumpet the other day, and he mentioned his mother-in-law had died. Everybody here has been affected. We've also seen our own colleagues become critically ill, and we ourselves at our hospital have lost 2 colleagues, unfortunately. On top of that, we're having some of the worst social unrest in living memory that we've seen in the United States. I've just visited New York City 2 days ago, and it's heartbreaking to look at the devastation and sense the anguish that our nation is in. And that has caused an acute rise in anxiety. Physicians and patients alike are afraid of personal safety. Physician colleagues are speaking about exploring the possibility of owning firearms and learning how to use them. And that is in this lovely area, very near to our moderator here in Long Island, which is a beautiful area. So there is a real sense of loss of life, loss of the life before the pandemic, and now loss of law and order. And that will take us a very long time to recover from. I think I want to get close to the end of my remarks and then listen to people's questions, hopefully. I came across something very interesting. And unfortunately, the book is in German. And there is an author named Charlotte Beradt, B-E-R-A-D-T, in 1968 wrote an account called The Third Reich of Dreams, about the impact of being under Nazi rule on the recollections of people's dreams at that time. And that book is actually widely available in German. So if anybody is able to read German, please look at it and tell us about it. But I think it tells us when we have mass events that impact massive numbers of populations in devastating circumstances, it will appear in our dreams in a way that perhaps we have something to learn from. And the very final observation is, and many of the things that led me to meet Peretz and know about the Technion was the rising calls for academic boycott against Israeli institutions, which is an expression of rank anti-Semitism, in my opinion. I have done a lot of work in the last decade on defending people against anti-Semitism and understanding the legacy of the Holocaust and genocide. I have finally found myself thinking in this pandemic about a visit I made a year ago to Rwanda to commemorate the 25th anniversary of the genocide there. And I feel this environment that I'm in now, where no one is untouched by death, where everyone has lost someone, where everyone has been bereaved or knows of a bereaved with not even 1 degree of separation, must surely be the climate that may be in somehow resonating with genocide, not in the same dimensions, but in the same character. We have now in the United States 110,000 deaths. That is the scale of a genocide. And we may have much to learn about the research that's been performed on genocide survivors and people that have lived through those eras. It's my pleasure to join you.
Thank you, Peretz and Kanta. I was all ears. This was fascinating discussion, and I have a number of serious questions that have been posed. But I have to start with one that's a little more lighthearted, just to change the mood a little bit. Peretz, has your dream patterns changed since leaving the presidency?
Yes, indeed they did. I almost stopped dreaming about the Technion. You know, I dreamt about the Technion while I was a president, and mostly about issues related to budgets and manpower, etc. Now my dreams are much more universal. And as Kanta said, and by the way, Kanta, I have this book you mentioned, the Third Reich, yes. My dreams are more universal, and in recent months, I found myself again remember intensively dreaming, and many of them are related to the situation, to the current situation. Absolutely.
Interesting. Kanta, I was fascinated by, and others have commented in different ways about these levels of stress. The people with sleep disorders to begin with, layered upon that the pandemic, and then possible economic problems, and then possible the racial situation and tumult. How does one create some sort of sense of normalcy and try to move towards a more normal pattern?
Jerry, I mean, what I'm finding is this is the second week that I've started to see patients in my office. There are enormous numbers of restrictions in terms of who can come to see us and what we wear and what we have to do. So we're capable of seeing fewer patients than normal. But I find with every patient interaction, there is a sense of relief at the human interaction, both for me and my patient. Part of the anxiety that's on top of all of this is the profound social isolation that many of us have never experienced. I live alone, and this is the first time that I've perceived the fundamental lack of family and how important family is in times of hardship. So I think that the most important thing is for us to tell each other, these are terrible times. These are not normal times. And then aim for very small gains. Make an agreement. Even if my patients are now stuck in a delayed sleep phase pattern, we agree, make your bedtime 2 a.m. every day. Don't vary it to 5 a.m. or 4 a.m. We agree, now that the weather is better, please go outside and go for a walk. And we set very small goals. Some of my patients are disabled and walkers. So I think small increments. And then I find that I'm recalling my patients back to the office, sometimes more often than normal, just because I sense that they may need an activity to do, a sense of purpose, a place to go, and a little bit of encouragement from me. And for us as clinicians, you know, American culture is very much about talk shows and letting it all hang out. But when you actually know Americans, very few go and seek psychological support. And so for myself, I've been supported by my clinical psychologist almost every day since the beginning of the pandemic. And I think that has helped me enormously at some very difficult times. I also think it's important not to deceive patients. You as an American will know that these times of difficulty are not going to go away. They may even intensify as we approach an election. And we have been in about a 6-year cycle of intense alienation from each other that is set to continue. And therefore, I look for very small victories in my day and with my patients to try and benefit. Wherever possible, I do refer them to actually a former Technion expert, my colleague, Dr. Gila Hertz, who's a talented behavioral sleep specialist and did her PhD in Peretz Lavie's lab. So I help my patients in whatever way I can. But we have to acknowledge there are only limited things that we are in control of at this time. And that's anathema to Americans.
Peretz, any advice for, and then Kanta, any advice for parents who are dealing with youngsters who are exhibiting sleep and dream patterns, whether that might be 5 years old or 15 years old, but any advice?
I believe that the issue of flooding with information and exposure to the media is very important. We are constantly bombarded by information about the pandemic, about issues related to what Kanta mentioned, the social protest, etc. Limiting the exposure to this information is very important, particularly to youngsters. And again, keeping them in a routine way and structure their day, I believe, is very, very important. But we are all living in the social media universe. And somehow this affects both our sleep, our dreams, and our mental life. So I truly believe that limiting the exposure is one of the key issues, particularly at a younger age.
Kanta, anything to add to that?
I think that that's absolutely right. People are not even aware that we have pediatric sleep specialists, and there are many accomplished pediatric sleep specialists, including in the Long Island community. My routine, whenever I see an adult, is to inquire if they have children and ask about the sleep disorders. So we identify that. I actually think people are so overwhelmed that they will not be thinking of a sleep evaluation early on. People will now be addressing their diagnosed cancers, which have been awaiting intervention, and they will now be going to maybe for their cardiac cath, which has been delayed. There are many critical procedures that did not get done in this shutdown, and maybe later we will begin to see some of the sleep issues. The other thing I'm expecting, though I have no evidence for it, is we're going to see an increase in the number of numbing activities that Americans engage in, whether that's substance abuse in the form of alcohol or other drugs, whether it's addictions like gambling or overeating. I think we'll start to see that manifest. Speaking to my psychiatry colleagues that were actually with us in the ICU managing the sedation of these patients, they have already seen more psychotic breaks, more anxiety, and more depression intensify. So there's going to be an increased demand on mental health services, which are already very weak and poorly funded in the United States. So we'll have a lot of work to do. There'll be no shortage of work for sleep specialists, that's for sure.
Let me add something, Jerry. You know, for many years, we believed that mental illness is associated with sleep disorders. So depressed patients suffer from insomnia, and schizophrenia is associated with sleep disorders. The recent studies showed that this is both way influence. So insomnia, prolonged insomnia, chronic insomnia can lead to depression. And this is a vicious cycle. It's a vicious cycle. People who are suffering from insomnia develop depression. Depression in a way affects sleep. And this is another danger of having a chronic sleep disorder that is not treated and is not resolved.
Interesting.
That's one thing, if I can add, that's just occurring to me. The other aspect that went completely unaddressed, I talked to you about how many deaths. To give you a sense, I rotated in the ICU for 50 days. I probably looked after close to 3 or 4 dozen patients. Only 2 of my patients survived. None of the families were able to have a proper funeral service. The patients after they passed away, there were very delayed burial procedures, very limited people allowed at the graveside, some funerals conducted with the funeral goers in cars. So I think we're going to see a lot more complicated bereavement. And I think the other thing that we're mourning at the moment in America, apart from the ongoing loss of life, everybody must have seen the New York Times front page where 100,000 people had passed away and their obituaries were printed of 1,000 of them, is that the pandemic has caused a profound breach in trust. America has always felt, for those that have been blessed to live here or visit here, as a place of safety and a place of plenty and a place of certainty. In the pandemic, the first breach in social trust was, I don't know if you're infected, let me protect myself, let me keep my distance. I don't know if I'm infectious, let me protect you. Then we came with that, the amount of bereavement and not being able to go to a place of worship. Now we've seen that we can go to protest, but we still cannot go to the synagogue or the mosque or the church. And now we've seen in the pandemic so many changing recommendations. Hydroxychloroquine is good, it is bad. A vaccine is coming, nobody has made an mRNA vaccine. Face masks mitigate the risk, face masks do not mitigate the risks. Our public health leaders have gone back and forth on almost every recommendation, and we've had to practice through that, literally by instinct, as well as what little knowledge we could garner. So with that on top of the social unrest, I now found when I visited New York City for the first time since the upheaval, I was fearful of strangers in a way I have never felt. And I've traveled to the most dangerous parts of the world and come back and always felt safe in New York at 2 a.m. That feeling has gone away, and it will take time for us to rebuild. And with that comes a lot of anxiety about the unknown, about the future, about jobs, about homelessness. And that's not going to be unique to any one demographic in the society. It's going to affect everybody.
I fully agree with you, Kanta, and this shattering of our world has to be digested in a way. We have to incorporate all these uncertainties and anxieties in our mental life. And this is part of the reason why dreams have become, I believe, some unusual aspect of dreaming is a digestion of all these uncertainties. And I'm glad you mentioned about this website, because this is a very interesting area that we should look into. Difficult
and
to
also
say.
And also submit our dreams. I dream
Right.
of COVID. If anybody missed that, I dream of COVID, I with a little I.
Yes.
Wow. Qanta, did I hear you correctly that in the course of 50 days, you saw 2 or 3 dozen ICU patients and only 2 survived?
Yes, yes,
Wow.
yes. And I think this is part of the public's difficulty, because there is a lot of the public that got infected, have antibodies, didn't even know they were ill. I've seen some of those people in my office now. And there were many people who had very mild symptoms and would never come to medical attention. The hospitals were shuttered off and sealed. Nobody could visit. During this period, I administered the last sacrament for my Catholic patient. I had to say the final shahada for my Muslim patient. The priests and imams could not get in. The rabbis could not get in. One of my colleagues put a prayer shawl around the body of one of our patients because the rabbi could not do it. The body bags were not opened by the funeral directors. Nobody would touch the remains of a COVID person because of the fear of infection. And of course, you know about the shortages of morgues, and we had refrigerated trucks outside our hospital for a long time too. So I think that we as a community need to grieve. And it took us a decade or so to resolve 9/11, which is still not resolved. We still look after the sleep disorders of those survivors that responded to that event. So yes, it is a very big task ahead for all of us.
For sure. Let me switch gears just a little bit. Peretz, here's a question from somebody. Why are dreams so difficult to remember? It feels as if my dreams disappear from my conscience in the morning while I am contemplating them.
Well, again, the most important factor that affects our ability to remember dreaming is what is the exact time that we wake up from sleep. Is it during the period during which we dream, which is the REM sleep, that is only 5 minutes during the first 2 hours of sleep and maybe 15 minutes at the last hour of sleep? If we wake up during dreaming sleep, the chances are about 80%. 8 out of 10 awakenings, we remember a dream. But if we wake up few minutes after the end of the dreaming period, it goes down to 10% or 15%. And these dreams that are experienced outside the dreaming period have different characteristics than the dreams that we have during dreaming sleep. They are less emotional, less complex, no heroes, no plot, usually some kind of one line that we remember, etc. So this is the most important factor when we wake up from sleep. In order to get dreams of patients, we bring them to the laboratory, we wake up to see the brain waves, the eye movements, and then we wake them up. And then we get 8 out of 10 awakenings, we get a report of a dreaming. So this is one factor. The second factor is a personality. There are people who are recallers, who tend to recall dreams, and there are people who are non-recallers, who less remember dreams. So when you combine the two factors, then you have the explanation why some people remember the dreams and why some don't. What I mentioned before is now that we don't have a limitation and we can sleep up to 10 o'clock, 11 o'clock in the morning, during this period, dreams is very intense, and sometimes we spend about half an hour of every hour in dreaming sleep. So the chances of remembering dreams are much higher.
And Jerry, if I can just respond to Peretz, one thing that may change in my practice is I may actually begin interviewing patients about their dreams. It may sound incredible to the audience, but a clinical sleep specialist in the USA usually never ventures anywhere near the dreams. The only clinician that asks me about my dreams is my PhD in psychology that treats me every Tuesday. So I think this has to become an integral part of the sleep medicine history in the way that it has not before. And then also I want to direct, and I can send this to you for viewers afterwards, there was a very important article in the Washington Post just yesterday about the burdens, the mental health burdens on the healthcare professionals, and that we are expecting legions of healthcare professionals to have formal diagnoses of PTSD.
Yes.
We've already had tragic suicides committed by healthcare professionals in New York City during this event. We know of at least one healthcare professional who appears to have attempted suicide within our institution. So I think that we may need to change how we take our sleep medicine histories, and it may have been an oversight that the medically trained sleep specialists have never read Freud's interpretation of dreams, myself included. It's on my bookshelf, but I didn't read it. And we do not know how to interview dreams. Even when we have PTSD patients, I stay away from dreams because I don't have the psychological skills to put the patient back together before they leave my consult room.
Yeah, I believe that PTSD or post-traumatic stress disorder in relation to the pandemic is something which is, again, very, very new. Usually we associate PTSD with wars, used to be called the war neurosis many years ago, or with catastrophes like the 9/11 or an earthquake or any tsunami. But here there is a new trigger of PTSD that may affect life for a very long period of time. Absolutely. Absolutely.
And let me ask Peretz a question, Jerry. Sorry to jump in. Because Israel is so unique and has survived so many conflicts, and so much of Israel's civilian population is in fact exposed to military service, and you have the world's deepest repository on management of PTSD, do you think some populations are more resilient to disasters like the pandemic from a sleep standpoint and a psychological standpoint than, for instance, Americans who've not had any conflict on American soil since Pearl Harbor, 9/11 aside?
Yes, I truly believe so. And I think that previous exposures to stressful events and people who experience stressful events and overcame it, I think are much more resilient to events like this. But again, I must say that in Israel, we didn't see the medical catastrophe that you described. As you mentioned, in your hospital, there were more patients on ventilators than the entire state of Israel. So we didn't experience the stressful life of the medical staff as you described. And I hope we won't. But absolutely, I believe that previous experience and life stories make you either more resilient or less resilient to stress like this.
So that's an interesting segue to a couple of the different questions I see on the screen. The effect, the difference internationally. You are both well connected with colleagues around the world. How are sleep disorders and the effect of the pandemic and the tumult that we have at so many levels, how are there not differences among different international populations?
As far as I can say, it is universal. A sleep disorder is a sleep disorder is a sleep disorder. And the number, I read some reports, for instance, from Norway and the Scandinavian countries, and you know that Sweden has become some kind of a lakmus test for, an open society that didn't impose any restriction. The percentages of people complaining about sleep in the Nordic countries is about the same. So I don't believe there are much differences, at least in the Western world. I'm not talking about China, I'm not talking about Far East, I'm talking about the Western world. I do not believe there are much differences based on culture or based on geographical location. Kanta, do you know about it?
No, I don't, and I've not read anything about it. I have been connecting with international colleagues, but in critical care and not in sleep during this time. So I don't have anything to add to that. But that sounds very reasonable. What I do think we may find is at the last data, which is at least a decade old, we have over 1 million sleep lab beds in the United States for a population of 330 million. Most people in America do not get a sleep evaluation. Medical schools are still struggling to teach sleep medicine at the medical school level, let alone the residency or fellowship level. And I believe one of the reasons why the pandemic struck the United States so hard is because of our very high prevalence of obesity.
Yes.
So I think this pandemic will be a big trigger for people accessing sleep medicine for the first time and lead to very common diagnoses of sleep disordered breathing. So we may need to be training more sleep specialists than we have done. And this last year or two, we have not been able to fill our fellowship spots in sleep medicine, even in the most prestigious programs in Stanford and Harvard, because the demand and the reimbursement for sleep medicine may be dropping. So that's another shortage in our healthcare services.
Yes. Yeah.
Interesting. So someone has asked, and they picked up on your comments about Kanta, about your research in mass gatherings. And they were equating this to loosening the valve, if you will, in different ways, in different countries, and even different parts of the United States. How does this affect sleep and dreaming, this loosening of the opening of the valve, so to speak?
So that's very interesting. My research and work with that has been since the late 90s, when I lived in Saudi Arabia and began to be involved with the research of health at the Hajj, the Muslim pilgrimage to Mecca, which draws about 2.5 million people annually. Very interestingly, because of Saudi Arabia's experience of managing Ebola, Rift Valley fever, H1N1, swine flu, all of these pandemics, they were one of the earliest countries to seal their borders and immobilize their citizens, and they put actually a 24-hour curfew on Mecca. Not the first time. Throughout Islamic history, there have been more than 40 times that the Hajj has been suspended, often for death and disease. So what has so enraged me, and that's the right word, is the encouragement of social justice protests by Governor Cuomo and by Mayor de Blasio here in New York City, where we've had more impact of the pandemic than we know of to be seen in Wuhan, China, where it began, at a time when still I cannot gather with 10 other doctors in person to discuss a patient. That was so irresponsible. We certainly cannot keep the economy locked down, and we may even have been mistaken in paralyzing the entire economy, as opposed to vulnerable individuals or individuals over a certain age, or maybe individuals over a certain body mass, because we know there are innate and adaptive immune defects in people that are dealing with obesity. But that seems to have been thrown out of the window, and that's part of the mistrust that's happened. So in New York, we are fully prepared. The protests went on for 10 days, and I think still are going on, to see another surge 2 weeks from now. And perhaps I'm going to have to close my sleep practice again and go back again into that scenario. That's what we're very afraid of. Also, people have been traveling across the nation for the protests, and the protests then mandate a big police presence. 1 in 6 NYPD officers were infected with COVID at the outset and were quarantined. Now they are shoulder to shoulder with each other and the protesters. People may be wearing masks, but they're shouting, screaming, singing. In some cities, tear gas and other smoke devices. And so the aerosolization risk is enormous. And we are about to see what the impact of that is. The mixed messaging from public health officials here in New York: come and protest for this social atrocity that happened to George Floyd, which I condemned. But how dare you hold a mass gathering for a Hasidic funeral some weeks ago, which I was also upset about because of the health risk. That creates an enormous problem. Let's say we face another pandemic. Who will listen now to social distancing and immobilization again? And who will agree to have the economy paralyzed again, which I hope to God it never happens again. So releasing the people needs to be stepwise. Notice we're doing that in New York. where the cases on Wednesday went down to 0 deaths from COVID at a peak of just under 1,000 a day. That's how many people were dying in New York at the peak. However, all the other states which did not immobilize and are fully open, they are seeing a rise in case. In Minneapolis, 12% increase in cases during the rioting was already ongoing.
So I have one, as we wind down, I have a question. Peretz, this is in your wheelhouse and the Technion's wheelhouse. It's about technology. And do you recommend using wearable devices to gain insight on our sleeping patterns? And do these devices help with improving sleep?
Well, it's very interesting because these devices, I pioneered using these devices some 25 years ago. And if somebody at that time would tell me that this will be a consumer product, I would say that he suffered from hallucinations. But lo and behold, yes, people who are using I don't want to recommend any of them, but many of them provide you with some, I would say, information that is a valid information about your sleep-wake cycles. I wouldn't trust much the sleep stages based on wrist movements, but it can provide you information, how good you sleep. It can, you can link your behavior to your sleep patterns. You can test yourself when you go to sleep, at what time, how long you spent asleep, etc. So there is no harm in using these devices. And in many cases, it helps you to regulate your sleep and to improve your sleep. Yes, I'm a believer.
Kanta, any comments?
So, you know, I've come around after speaking to my brilliant friend, Robson Capasso, who's chief of sleep apnea surgery at Stanford. I would have a vitriolic reaction if a patient pulled out a technical device. As soon as I started talking, they always want me to see their cell phone or their Apple Watch. And I just say to them, your history is more important than any device. But Robson taught me, and he's also one of the faculty in the Bioinnovation Fellowship at Stanford, as well as a brilliant sleep specialist. There's no going away from technology. The first thing Americans do is switch on their phones, check their phones. The last thing they do is check their phones. We have billions of nights of data through digital devices now, so it's not going away. I discourage my patients with active insomnia and anxiety from wearing devices because it fuels into their anxiety. And they start to see awakenings on their device as a sleep disorder, rather like a parent who monitors a baby on an intercom, hears the baby waking up, not knowing for centuries babies do wake up spontaneously and self-soothe and go to sleep. But on some patients, it can be useful. And I actually use the CPAP compliance data in a very similar way to show them if they're sleep deprived or getting enough sleep. But I agree about the sleep stages. People are very excited when they see deep sleep. That's what they're most excited about, and dream sleep. But I am also circumspect about that.
I think we'll call it right there. This has been a very interesting discussion. I mean, some of the people in the chat room have been talking about sleep as a barometer of our levels of stress and asking all kinds of questions. So there is no end to this topic.
Right.
On behalf of what I'm reading is almost 250 people on our webinar and others on Facebook on our audience. Wow. I want to thank you for your expertise and your insight and providing hope that a good night's sleep is not just a dream, that we can,
beautiful.
We can get back to that. The presentation has been recorded. A link will be sent to all of you within the next couple of days. Join us again in 2 weeks, Wednesday, June 24th at 2 p.m. Eastern, 11 Central, 9 a.m. Pacific. And the title is Food for Thought. And our speakers will be Technion professors Uri Lesmus and Avi Spiegelman. And some of the things that they'll be speaking about are organic foods always better for you, are processed foods always worse for you, and how can technology be used to improve our diets and enhance our nutrition. So I thank you and be well.
Thank you, Jay.
Thank you so much. Thank you, Peretz. Lovely.
Great to see you.
Shalom.
Shalom.
Great to see you. Shalom. Bye.